everyone, welcome back to my channel. Today this is the continuation of the part 1 video related to the previous question papers of the AIIMS-NORCET. Okay, and this paper is from the year 2023. If you didn't watch that part 1, just go and check it out. After that only you come to this video. Okay, because it's a continuation video. So shall we start the video? Let's get started. So in the last video we have done with 25 questions and this is the continuation of that video, 26th question, and here we are not going to explain everything in detail, so we are doing just as a mock test. Okay, 26th question, most common symptom of alcohol withdrawal is, so the options they have given: rhinorrhea, body ache, tremor, diarrhea. The option 3, tremor. Correct answer is. Next question, 27th question. Weber test is diagnosed to. The options they have given: eye problem, hearing loss, respiratory problem, cardiac problem. Weber test is done to diagnose eye problem, hearing loss, respiratory problem or cardiac problem. The correct answer is 2. Option 2 is the correct answer, that is hearing loss. 28th question. What is mandatory before glucose tolerance test? So what is mandatory before glucose tolerance test? So the options they have given: NBM 8 to 10 hours prior to test, rich carbohydrate diet from 2 to 3 days before test, stop the giving medications, no need to change anything. The correct answer, option 1. NBM 8 to 10 hours prior to test. NBM means nothing by mouth. 29th question. Hand rubbing time for alcohol based hand washing is. The option they have given: first 10 to 15 seconds, second 15 to 30 seconds, third option 32 to 45 seconds, fourth option 60 seconds. The correct option is 2, 15 to 30 seconds. 30th question. Identify the given image below. The options they have given: tinea corporis, bed sore, steam burn, flame burn. The correct option, first, tinea corporis. 31st question. Gastric lavage is a procedure done to wash or irrigate the. So the options they have given: stomach, urinary bladder. Third option, rectum, urethra. I think you have seen the answer. Gastric. So the name itself it is, the question in itself it is giving the answer, that is gastric lavage. So is a procedure done to wash or irrigate the stomach. Option A1 is the correct answer, that is stomach. 32nd question. Which fluid cause shifting of fluid from cell to plasma? So the options they have given: hypotonic solution, isotonic solution, alkaline solution, hypertonic solution. Which fluid cause shifting of fluid from cell to plasma? The option 4 is the correct answer, that is hypertonic solution. 33rd question. What are the benefits of kangaroo mother care? So the options they have given: it maintains temperature, it is helpful in breastfeeding, it increases the affinity between mother and baby. Fourth option, all of the above. What are the benefits of KMC, kangaroo mother care? The option fourth is the correct answer, that is all of the above. It maintains temperature, helpful in breastfeeding, and it increases the bond between the mother and the baby. So the option, the 34th question. Vidal test is done in the diagnosis of what? So the options they have given: rheumatic fever, hay fever, enteric fever, dengue fever. Direct question, and it asked in so many question papers, means repeated question it is. Did you find the answer? It's an option 3, enteric fever. So 35th question, which of the following electrolyte imbalance is associated with digoxin toxicity? So the options they have given: hypokalemia, hypernatremia, hypernatremia, hypocalcemia. Did you find the answer? It's an option. Correct option is 1, hypokalemia. 36th question, the infant has undergone for VP, that is ventriculoperitoneal shunt surgical procedure. On the assessment, how will you assess the sign of increased ICP, that is intracranial pressure? So the options they have given: respiration, blood pressure, anterior fontanelle assessment, and fourth option is uterine urine output. You have seen the answer. So the infant has undergone for VP shunt, that is ventriculoperitoneal shunt surgical procedure. On the assessment, how will you assess the sign of increased intracranial pressure? So the answer is 3 is the correct answer, that is anterior fontanelle assessment. 36th question. Parkland formula for fluid calculation in Burns patient: 4 ml into BSA into weight. The options they have given: 3 ml into BSA into weight, 2 ml into BSA into weight, 1 ml into BSA into weight. BSA means body surface area. One detailed video is there in my channel about the burns. Okay. In that everything was explained in detail. If you want, you can go and check it out. The correct answer is 1, 4 ml into body surface area into weight. 38th question. Intermittent positive pressure breathing is contraindicated in what? The options they have given: comatose patient, pulmonary edema, asthma, tracheoesophageal fistula. The correct option 4, tracheoesophageal fistula. 39th question, endogenous depression is also known as. So the option they have given: autonomous depression, reactive depression, bipolar depression, unipolar depression. Endogenous depression is also known as what? The correct answer is option 1, autonomous depression. 40th question, what is the ideal position during a lumbar puncture? It is also repeated question. So the option they have given: lateral recumbent position with knees flexed, supine position, lateral position with extra pillows under the head, Fowler's position. The correct answer is option 1, lateral recumbent position with knees flexed. 41 question, give the correct order of 5 stages of dying person. The options they have given: anger, depression, bargaining, denial, acceptance. Second option: denial, depression, bargaining, anger, acceptance. Third option: depression, denial, anger, bargaining, acceptance. Fourth: denial, anger, bargaining, depression, acceptance. It's an easy question and it is repeated question asked in so many exam papers. So the correct option is fourth: denial, anger, bargaining, depression, acceptance. So you can remember as a DABDA. 42nd question, which condition is defined as the inflammation of the peritoneum? So the options they have given: duodenitis, colitis, peritonitis, gastritis. Direct question. I think you people have guessed the answer also. So it's an option 3, peritonitis. Duodenitis means duodenum, colitis means colon, gastritis means gastric, means stomach. 43rd question. When caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? So the options I have given: turn the neonate every 6 hours, encourage the mother to discontinue breastfeeding, notify the physician if the skin becomes bronze in color. Fourth option, check the vital signs every 2 to 4 hours. So the correct option is the 4, that is check the vital signs every 2 to 4 hours. 44th question, after birth of a baby, breastfeeding should be started. So the options they have given: within 2 hours, within half an hour, on second day, after 1 week. When that breastfeeding has to be started? After delivery of a baby. So the option 2 is the correct answer, that is within half an hour. 45th question, the ratio of lung inflation of chest compressions in CPR, that is cardiopulmonary resuscitation. So the options they have given: 1:5, 2:5, 1:3, 3:1. The ratio of lung inflation of chest compressions. The correct option 3, 1:3 ratio. Next question, which of the following condition has an increased risk for developing hyperkalemia? So the options they have given: Crohn's disease, Cushing disease, chronic heart failure, end stage renal disease. In which condition there is a increased risk, high risk for developing hyperkalemia? The correct answer 4, end stage renal disease. 47th question, during resuscitation in an infant, ratio of chest compressions and ventilation breath should be. So the options they have given: 1:1 ratio, 1:3 ratio, 3:1 ratio, 5:1 ratio. During infant resuscitation, chest compression ratios. The correct answer option 3, 3:1. 48th question, a client with C4 spinal cord injury is at greater risk for. So the options they have given: neurogenic shock, respiratory compromise, paralytic ileus, stress ulcer. The correct answer option 2, respiratory compromise. 49th question, the microorganism that is usually a part of the normal vaginal flora but can cause meningitis in the newborns is. The options they have given: Corynebacterium species, Candida albicans, group beta, Streptococci, Staphylococcus epidermidis. The correct answer option 3, group B, Streptococci. 50th question, a pregnant woman diagnosed with severe anemia, that is HB less than 7 grams per dl, will be treated by. So the options they have given: advice to take food rich in iron and vitamin C, advice to take iron and folic acid tablets 1 OD for 1 month, packed cell transfusions, administered iron injection 1 per day for 1 month. Correct answer, packed cell transfusion.